Dr. Warren has kind enough to come to our mini studio today to entertain us and to give a talk about robotic surgery, which is the main topic for today. So I just going to brief a bit about Dr. Warren, about his background. So Dr. Warren is a consultant urologist in which he specializes in urological issues such as urinary stones, urinary tract cancers, and also recurrent urinary tract infections. He also specialized in female and also male urological health problems. For example, overactive bladders, urinary incontinence, and also for men's health such as erectile dysfunction and also prostate diseases. Okay, so basically Dr. Warren was trained in Malaysia and also in overseas, in which he got his training, subspecialty training in the Queen Elizabeth University in Glasgow in UK. And also, he also trained in University Hospital California Davis in California, United States. So yeah, he's been all over the world. And then the main reason why we are inviting Dr. Warren today is because he is the subject matter expert for robotic surgery. So basically, he is one of the highly trained and Europe certified robotic surgeons, in which he specializes in various complicated robotic surgeries for prostate and also kidney cancer. So how does he obtain this kind of qualification? So he obtained his training, his fellowship training in robotic surgery in Peter McCallum Cancer Center in Melbourne and Guy's Hospital and St. Thomas Hospital in London. He was also trained in PT Salpêtrière Hospital in Paris. So basically, like I said just now, he's been all over the world and to obtain all those knowledge and skills and bring back that robotic surgery skills to Malaysia. And he also is the recipient for the prestigious Tun Sufia Foundation Scholarship, which has supported his training in Guy's Hospital in London. Okay. So first of all, just a bit of introduction about robotic surgery. So robotic surgery has been in Malaysia for quite some time, for many years. I would say for more than 10 years, if I'm not mistaken. In which, however, the acceptance and also the awareness about robotic surgery is still very low. In which I would say the layman perception of robotic surgery, in which it is conducted by a robot instead of a human. However, it is basically a mixture of a human being, which is a surgeon, such as Dr. Warren here, in which he will operate the robotic console on the patient itself. So that's why we have Dr. Warren here to perhaps to show what is robotic surgery is all about and explain further on the benefits and things relating to robotic surgery. So Dr. Warren, perhaps my first question, perhaps the audience would like to know is they want to understand what is actually a robotic surgery. So can you tell us how does a robotic surgery works and also what type of procedure that can be done through a robotic surgery?
Well, thank you, Dr. Jasman, for a very kind introduction. So the robotic surgery, as we thought, must be operated by the robot. Okay. Basically, we humans are the one that control the robots, essentially. Mm-hmm. So what we do is that we basically will sit in a console, and then the patients will be on the couch. Okay. And then the robot with its four arms, there are instruments that were introduced into the patient's abdomen, okay. And then the nurses will be there to change the equipment. So it can be forceps, it can be scissors, it can be knives. And then after that, we are operating through that very tiny incision. Okay. So it's essentially about 1 centimeter. Okay. And of course, the one that we have to remove the specimen will be a little bit larger, depending upon what we are taking out. Sure. So we could be taking out bladder, we could be taking out prostate, we can be taking out kidney. Mm-hmm. So that incision will be depending upon the organ that we are taking out. So the rest of it will probably just about 1 centimeter or so. Okay. So now what we do is that the surgeon will be sitting just in the console, and then the nurses will be beside the patient. Okay. Now, we sometimes need 2 nurses and sometimes we need just 1 nurse. But the important thing is that when you kind of control the robot, mm-hmm. the arms of the robots will be moving. So with the instruments mounted onto the robotic arm, it will be introduced into the patient's abdomen. So patients will be lying down, and then the case will be inflated. So there will be a space in there. And then the instruments will be moving around, targeting towards the organ that we want to remove. So essentially, it's still very much controlled by the human. So when we surgeons are operating on a patient, we must know also, you know, the robot itself, meaning to say that you should be able to troubleshoot if anything goes wrong. It's almost like a mechanic, right? So not just trying to find out which organ, you know, what are the things that we need to avoid, but at the same time should be able to troubleshoot if anything goes wrong.
All right. So perhaps I think perhaps we can see the feed or the picture of the robotic surgery itself. Okay. Is it okay if appear in the screen here? Okay, so basically, I hope the audience can see this is the setup for the robotic surgery, in which, as what Dr. Warren has explained just now, basically the surgeon will be operating this robotic surgery equipment, I would say.
Correct.
Yes, equipment through a console. And then the nurses will be the one that assisted the robotic arms as per what being displayed over here. So is there anything else that you want to explain on this image?
Yes. So the advantage of robot is not just, you know, operating through a very comfortable environment, but at the same time, also, you know, that the robot have the capability to enhance the vision, the image. So we basically are looking at 3D image. Essentially, let's assume that we are actually operating on a prostate cancer. So you know that the prostate cancer is situated just right below the bladder. So, and man has a very narrow pelvis. So those days we want to operate on prostate cancer, you know that the incision has to be made from one end to the other end. And then the assistant will be trying to retract the abdominal wall for the surgeon to be able to advance his hands into the targeted organ. And it's actually very narrow. So most of the time you can feel it, but you may not be able to see it very well. And also around that area, there'll be a lot of blood vessels. So sometimes bleeding can be quite an issue. So with this 3D vision, essentially it's almost like putting our head inside the very narrow pelvis. So you're looking at the abdomen and looking at the targeted organ is just right in front of you. It can be magnified up to about 10 times. So you can imagine that it's almost like a little fly flying over into the patient's abdomen, and you know you can actually do anything that you want with that kind of a vision. So it's actually fantastic.
Wow. Okay. So most probably we can go to slide number 8, so that we can see what Dr. Warren mentioned just now on the vision. Okay, so basically this is the instrument in which maybe the next slide. Yes. Okay. So this is basically the one that you mentioned just now, in which the surgeon and also the nurse can see, probably can see on the screen.
That's right. So basically, what we are looking at, the nurses are actually looking at the screen, and what we're looking at, the surgeon will be looking at the screen in the console. So the nurses will be looking at the 2D screen, whereas the surgeon will be looking at the 3D screen. So there's a little bit of a difference there.
Okay, sure. All right.
Yeah. So you can see that when we operate, we basically just put our finger into the little gadget there. So when we operate, we use both the hands and both the legs. So we're actually operating with 4 limbs at the same time.
Oh, so basically you're mentioning, okay, this is the picture of the console.
Exactly.
So your hands and your legs are probably at work.
Exactly.
Okay.
So the advantage of it is that you can imagine if you were to do a laparoscopic surgery last time. So laparoscopic surgery is almost like a chopstick surgery. So you can actually maneuver it from, you know, just in front of the patient, but there are limitations in terms of the movements. Whereas when it comes to robot, you can turn your wrist like that and the robot will turn the wrist like that as well. So it's like as much movements as you want it to be. So that kind of like transcends the limitation of the previous laparoscopic surgery. I think that's the main advantage.
Okay, okay. Thank you very much. Okay, so basically, probably the next question that the audience would like to know is basically the success rate and also the safety of robotic surgery. So yeah, if you compare on the success rate of conventional laparoscopic surgery versus robotic surgery, how many percentage or how successful is robotic surgery as compared to that kind of surgery, the conventional ones?
Let's put it in a simple way.
Okay.
If you were to give me a choice of laparoscopic and robotic, which one would I choose? Well, I would definitely say robotic. Not just for the advantage that I was talking about just now, but you also must understand that the robotic machine is obviously a very expensive machine, not without a reason. Now, the laparoscopic surgery only provide you about 2D vision, whereas this one is a 3D vision. Okay. So when you talk about the success rate, with the advantage of 3D, with the advantage of 10 times magnification, possible from the robot side, not possible from the laparoscopic side, there's a lot of fine details that you can actually know about the organ. So things that you should avoid, the nerves, all these are very, very fine, minute structures. They will probably want to avoid, especially when doing a prostate cancer surgery, because preserving the nerve is like preserving the continence mechanism and also the erection for the patient. So it's very, very important, vital for us. So if you were to ask me about the success rate, I would say with all these advantages, the success is definitely higher. So it definitely gives you a better oncological as well as a functional outcome.
Okay. So probably I forgot to ask you on what type of procedure or what type of diseases that can be done through a robotic surgery apart from urology surgery.
You did mention it.
Okay.
Yeah, you did mention it. So I forgot to answer. So the type of surgeries that we can do can be divided broadly into the functional as well as oncology. So oncology essentially are cancers, cancer surgery. So you can use the robot to remove the prostate cancer, the kidney cancer, the bladder cancer, so all sorts of cancer, even the gynecological cancer. And then that is for the field of urology. And then the functional part, we can actually use the robot to put an artificial urinary sphincter robotically so that the patient will not have so much of a leaking. But that is just pertaining to the urology field. But it's also open up to all other fields. For example, the fraternity of general surgeon, general surgery, gynecology, ENT, thoracic surgery. So all these things are possible with robots. So robotic is not just for the urologist, it's actually for the cardiothoracic surgeon, thoracic surgeon, gynecologist. There's so many people. So there's a huge advantage of that.
Okay. So I think the audience may like to know in Malaysia itself, what type of procedure that can be done through a robotic surgery?
I think for the field of urology, I mentioned to you the prostate, the bladder, the kidney cancer, the prolapse, and also the anti-incontinence surgery. And of course, the gynecology side, they can do the kind of hysterectomy, the fibroid surgery. ENT, they can probably do the thyroid, the stroke surgery as well. So general surgeon, you can talk about bowel surgery. So anything which is possible with laparoscopy can be performed with robotic, with much more detailed information and also precision. So precision is a keyword.
Okay, sure. All right. So basically, robotic surgery is they require a highly trained surgeon in order to do this type of surgery, because I would say it's not easy to operate a console, isn't it? Because I believe surgeons has been trained to use their hand to do surgery, but this one instead you need you kind of like operating outside, not basically touching the patient.
Outside our comfort zone basically, because we surgeons are very used to touching the organ, and we feel the confidence by touching the organ, so we know what we're removing. But the advantage of robot is that because it's in 3D vision, it's almost like putting our head in there. That's the difference between it and also the laparoscopy, which is 2D vision. Something like that, 3D vision, it kind of like almost mimic the fact that you're actually holding the organ. So it gives you some kind of a tactile sensation. So you almost feel that you're actually touching the organ.
Wow. Okay. Wow. Okay. Quite good. Okay. So probably, what is the key benefits of robotic surgery compared to the conventional surgery?
I think for surgeon is the ease of operation, because number one, you know that for the longest period of time when we operate on a certain organ, especially when it comes to very major surgery, we tend to stand up, and then after that we operate on it, and you know that it takes long hours and we get fatigued. You know, but this one, you can actually wear pajamas and operate on the patient in the comfort comfortable sitting position and
Okay.
operating onto the robot.
Oh.
And yeah, and also at the same time, the main advantage is basically comes from the patient, because with a very small incision, the
Yep.
patient recovery tend to be faster. And if you can actually see the organ in such a fine detail, so if there's any form of a bleeding, you can almost catch it immediately and burn. So the blood loss become much less. And the vital organs that you will want to avoid, you can actually avoid quite easily because it's magnified about 10 times. So you can see it very, very easily. And then at the same time, the patient can recuperate pretty fast and going back to daily normal routine activities pretty fast as well. So less blood loss, less
blood
pain
loss, yes.
because it's very fine incision, and also early recovery, early less injuring to the neighboring organs. So these are the things I think that I would say that robot has definitely a lot of advantages.
The key benefits
That's
for
right.
robotic surgery.
Yeah.
Yes. So basically, all in all, because of the precisionness of the robotic surgery itself, and of course has been must be done by a skilled surgeon. So it leads to basically a shorter hospital stay, and then less wound infection, less pain, less complication, and ultimately it leads to faster recovery and basically return to normal activities.
Exactly.
And basically perhaps can reduce the cost of the admission itself.
Yep.
Okay. All right. So basically, probably the next question will be the evolution of robotic surgery in Malaysia itself. So perhaps I also not quite sure when did Malaysia has robotic surgery itself, and when does it start, and then how does it evolve up until today. So probably maybe you can share with us the evolution of robotic surgery in Malaysia.
I think that is an important part of it because, as you know, the reason why we have this session is to promote the awareness about the availability of the robotic surgery. So robotic surgery was first introduced to the world in year 2000. And in year 2003, Malaysia already acquired 2 robots.
2003.
2003. So there are 2 robots, but it was a first generation robot. Then it was actually placed in a general hospital. So because of no marketing, no promotion, a lot of people are actually not aware that we have been using the robotic surgery to operate on organs since then. So I think it's only until much later where the private hospitals start acquiring the robot. Then more marketing, more promotion, and people come to be to the awareness of the availability of the robot, because we obviously know that there are advantages, and we of course hear it and see it from the internet and all this, because nowadays people are quite intelligent, so they will want to know what is the best option, surgical options and all these things. So I think it is very important for us to create the awareness to let people know the advantage of it, and also to know that what the robot can do. And it's absolutely safe because when we operate on the robot, even though we are not there with the patient, but we know how to fine tune, and of course we know how to troubleshoot. So please don't think that, okay, if the robot is like a machine, if it breaks down, so what's going to happen? There are a lot of backup plan for that. There are a lot of backup plans. So we know how to troubleshoot and all this. So operating on a patient with a robot is not merely just operating based on your surgical skills and your knowledge. It's also learning how to operate onto the robot. So that's why it requires training as well. So with this, the advantage of this robot, obviously the trend of this robot has actually continued. So previously we used generation number 1, and nowadays we have generation number 3. And I think in the overseas, they probably have generation number 4 as well, which actually is much better. Yeah.
All right. So based on your experience, how many patients that I would say that you receive that comes to you and most probably not requesting that probably indicated for a robotic surgery, probably in a year or in a month?
Well, I would say that depending upon what the patient has. If the patient have cancer, they would definitely try to put them early. So if the patient have something like, for example, a prolapse, which is not cancerous, not so life-threatening, then we will tell them that, okay, you have some time to think about it. And after that, when you're comfortable, then you can actually get onto the robot. So when it comes to this robotic surgery, it depends on whether you counsel the patient in the general hospital setting or in a private hospital setting.
So
obviously in a general hospital setting, there's always a waiting queue there. And robotic surgery in a private hospital is much faster. So then of course, a cost is also something that you need to actually pursue and tell the patient. Because the robotic surgery is not something which is cheap, because obviously this robot itself is actually expensive to start off with.
Okay.
The maintenance, the servicing, and all these things does come with a cost. So the patient should be able to absorb all this, and of course, there are insurance that can cover that as well.
Okay.
So when it comes to general hospital, it's free, but there's a waiting queue there.
Okay.
Yeah.
So when you mention a general hospital, which hospital that offer
Kuala Lumpur General Hospital?
just HKL for the time being, is it?
Yes, for the time being. Yeah, we used to have one in Kuching, but that was the first generation, and now we only have the third generation one in Kuala Lumpur General Hospital.
Okay.
Yeah.
All right.
And even then, also we managed to stretch on even because one lifespan for a machine is probably about 10 years, 8 to 10 years. But even then, also we managed to stretch one up to about 12, 13 years before we move to the next generation. That's right.
Okay.
So, yeah.
So the robotic console that's available in Gleneagles KL, is it the latest generation?
It's generation 3.
Generation 3.
Yeah.
Okay. All right. Okay. So may we know if there is any other private hospital out there that also, I would say, offering robotic surgery?
There are quite a number of private hospitals out there as well. So so apart from the clinicals, I think some teaching hospital like UITM, UPM, and also Sambe, they also have the
facility as well.
That's right.
So, however, from my experience, I think Gleneagles offer the best, I would say, in terms of robotic surgery and also the services covered under robotic surgery, in which I think apart from urology, there's also other specialties as well that offer robotic surgery.
I think there are a high usage of robot.
Yes, high usage. Yep. Okay. So I think, okay. So maybe because even though robotic surgery has been in the private setting, I would say, for many, many years, do you think that there's an increase in cases in terms of cases that needing robotic surgery, or is it remain the same throughout the year?
I think if you were to ask me, because of the awareness nowadays, because people are more conscious about their health.
Okay.
So they go for health screening. So I think more and more cancers being picked up. So I think in a way it's good because the early awareness, we are trying to achieve a cancer clearance. Essentially, it's a cancer cure.
Okay.
So it's better always to capture the disease fast enough and cure it so that you can, give them a complete healthy life rather than dragging on, and eventually when the cancer spread elsewhere, you probably will tell them that, okay, we can't cure you, but we can prolong your life. So that is not, what it should be.
Yes.
So I think with the creation of awareness, I think a lot of people tend to go for health screening. So more and more cancers tend to be picked up nowadays. I think it is good. Yeah, it's good. Previously, when we have this census whereby most of the cancer patients that come to us are pretty advanced. And nowadays, you can see a switch of a trend that moving towards early detection of cancer. So I think in a way, it's actually good.
Okay, sure. All right. So basically, I think we come to the last part in which if the audience have any question and answer, probably we can help to try to answer the questions. Okay, so probably we have some questions here. The first one is from Nadira. So
I think we have to answer that.
Yeah, so the question is, which hospitals are currently offering robotic surgery? So just now, Dr. Warden already answered in which at the government hospital, the only available is in HKL, and also at the private setting. The only the available center is basically Gleneagles Kuala Lumpur and a few other teaching hospital as well. Okay. So the next question is, what is the improvement of robotic surgery since it's being first introduced in Malaysia? So I think this one I give for
kind of like answer as well.
Okay,
yeah. So you know that the improvements is in terms of the patient's recovery, better oncological and functional outcome. So that is the biggest improvement for surgery as compared to those conventional open surgery or laparoscopic surgery.
Okay, all right. So, and then probably the next question is, what can be done to improve the reception of robotic surgery in Malaysia?
I think the creation of the awareness is the utmost important thing, because a lot of people are still very skeptical about using a robot to operate. They would have thought that, okay, it's the machine that operates on me. Actually, they are not aware that humans are the one behind it, because we actually, you know, we kind of like control the robotic arm, and we using the advantage of a robot. That means to say the 10 times magnification, the 3D visions, and the precisions, and all these things. So, you know, you can imagine. Can you imagine that every forceps and, you know, the knife, the forceps, the scissors are actually just about a centimeter. So if you want to cut something, you have to put your whole hand inside there to cut something. But you use the equipment which is about a centimeter. So you basically have a lot of space, and you can go to very, very fine organs, and you can try to do every single thing in a very precise way. So that is the main advantage. Yeah.
Okay. Yeah. So probably when you say you can go into fine details inside the abdomen itself, for example. So how does it compare, for example, with a laparoscopic arm?
Well, the laparoscopic actually has some limitations in terms of movements. Because we are still operating using the two hands, to, you know, and then we are trying to negotiate certain angle, because when it comes to abdomen, there are certain organs which are in a very acute angle, for example, or in a very difficult to reach kind of position. So when it comes to laparoscopy, everything is very straight, and then after that you will need to use the laparoscope to actually go to the targeted organ. There may be some challenges unless you are very skillful and you have been doing it for a longer period of time. Then perhaps that one is not so much of an issue. But for those people who are actually in training or who has not done enough, that can be quite a bit of an issue. So there are a lot of actually surgeons that just bypass the laparoscopic way and go straight to robotic surgery training in many other countries, like for example Korea. So the surgeons may not know how to do laparoscopic surgery, but they already know how to do the robotic surgery, because everybody see the advantage of robot.
So I hope that answered the questions. And then the next question is it possible to do a knee replacement using a robotic surgery?
I think that one I may have to actually get the orthopedic surgeon to answer. I'm a urologist, sorry.
Yeah, probably, because maybe in the future, we may have some kind of robotic surgery for knee replacement or any, I would say, orthopedic surgery. But I think in Malaysia, there is no, I would say, orthopedic procedures that being done using a robotic surgery, isn't it?
I'm not so sure about that, to be honest. Yeah, so that's why I think it's better to leave it to the orthopedic surgeon to answer.
So basically, in essence, what does that mean is basically the field of robotic surgery is very much limited in Malaysia itself, and it's confined to probably specialties such as urology, gynecology,
the
ENT,
gynecology, the ENT, the general surgeon. So quite a bit actually. Quite a bit, yes.
All right. Okay, then the next question is, how much does a robotic surgery cost in general? So you want me to answer that question?
Well, I think depends, as I think we have actually gone through it, because in government hospital it's obviously free. And then in the private hospitals, I think, you know, most hospitals, they actually offer packages, you know, includes the hospital stays, the operating fees, the surgeon's fees, and all these things. So I think each hospital varies. Yeah.
Okay, all right. So basically, in terms of surgery, in terms of the cost for robotic surgery, it actually depends on the hospital itself. But based on my experience handling a lot of medical claims for many years, robotic surgery itself does not incur too much increase of a cost as compared to the conventional laparoscopic surgery or open surgery. In fact, due to the faster recovery and also lesser length of stay of the patient inside the hospital, so sometimes I do encounter whereby the cost effectiveness is very much higher compared to the conventional ones. So yes, so I hope that answers your questions. And then the next one is, how many surgeons in Malaysia are trained in robotic surgery?
A very handful of surgeons.
Maybe from urological
very
side?
few of us.
Very few?
Yeah, less than 10.
Less than 10.
Yeah.
For urology, or is it for the whole robotic
For the
surgery?
urology.
Okay, all right, sure. So basically, there's not many, I would say, doctors or specialists that are being trained in robotic surgery, in which most of the training are being done overseas, isn't it?
Yeah, that's right. Because I think it's important to go to a center whereby, you know, that it's almost like teaching you how to drive. So if you go to a center whereby they are double console, so when you're trying to operate on something, and then the surgeon on the other side is also sitting on a console.
Okay.
So it's almost like allowing you to drive or allowing you to operate. And after that, if anything goes wrong, immediately he will take over, but he's also operating because he's sitting at a different console. So I think the training is important. Go to the right center to get trained is very important as well.
Okay.
But the training is tedious because number one, you also have to go through, you have to know the technical part of it. And you have to, of course, gone through the theory part of it. And then you have to know how to troubleshoot the problem. So you have to have a simulator, train on the simulator before you get onto the real patient. You have to assist, and then you have to start step by step. So start to do these movements first, and then after that, the next movement, and then after that, you know, and then eventually the training will involve giving you the most complicated case and expect you to do it like perfect in a very short, limited time. So that is ultimate training. And with that, you can pass. Yeah.
So for you, Dr. Warren, how many years do you take to complete your training in robotic surgery itself?
And I think this one, because you know that I'm a functional urologist as well. So I was in touch with the robotic surgery since 2003.
Okay.
And then after that, been on and off sort of thing. So until recently, I feel that, you know, because of the litigation issues and all these things, it's always better for us to actually get a proper training rather than, you know, see one, assist one, and do one straight away like the old days. So I think it's no longer like people teaching you. You need to really know how to go about doing it because you're operating on real life human being. So I think it's important. So I think the training is important. So I think anybody who's interested to know more about the robotic training can contact me privately.
Sure. Okay, probably this is the last question for the day. Yes, from Haris, thank you. To date, how many specialists that we have in terms of robotic equipment specialists in Malaysia, technician or product specialist? I think just now, Dr. Warren already explained on this. Or do you have any more to add on this question?
What he meant is that, is there a company that is actually in charge of this?
Yes.
Yeah, so there is a distributor entrusted by the Da Vinci company. So they will handle if there's a faulty equipments, and then they'll be there to actually procure the equipments and to provide the services, the damage, you know, the repair and all this stuff. So there's a lot of things that they need to do. Yeah.
Okay.
So far in Malaysia, there's one.
There's only one vendor, I would say, that for robotic surgery. Okay. Then the next question would be, how do you foresee the industrial advancement in the world generally in terms of robotic surgery and in Malaysia, especially on the projection of years versus application? So basically, this is touch based on the evolution of robotic surgery in Malaysia.
Yeah.
So
basically, you can imagine that the majority of the prostate cancer in US is done robotically. So it's about 80% and 70% or more was done in UK. So you can see that the whole world is moving towards there. Malaysia should be one of those countries that is actually targeted towards that field as well. So I think that the creation of awareness is actually very important. People should not be skeptical about the robotic surgery. And they should know that they are actually much better in a better hand, in a robotic hand. You know, as I wouldn't say compared to a human hand, but naturally there are robots that the human cannot do. Like for example, putting your finger inside there 1 centimeter. How is it possible? How is it possible for us to put our finger inside there? Because the robot is possible with 1 centimeter. So, and 3D 10 times magnification, that is impossible with human. So I think it just combines the advantage of human technology and also the science technology. So I think it's a good thing.
Okay, all right. So basically, if there's no more questions, so hopefully that everyone have gained an insight about robotic surgery itself. So just to recap on what Dr. Warren has given his insight as well, in which robotic surgery is basically a surgery in itself, in which instead of using the hands of the surgeon, so basically it's use a robotic arm. It's like an instrument that can actually eliminate the risk, such as probably the surgeon's hand probably shaking or things like that, and also it provides whereby it's very much precision on the organs that need to be taken out or need to be operated on. So yes, in Malaysia, basically this robotic surgery, the acceptance rate is considerably low compared to other countries that Dr. Warren has mentioned just now. So we sincerely hope that with this Health Hack Series 2 webinar, which is on robotic surgery itself, hopefully we can spark something in which at least we can create some awareness on there is availability of robotic surgery in Malaysia. So we are glad, HealthMetrics is very much glad to have Dr. Warren and also Glenn Eagles over here to give a talk on robotic surgery. And also any of you that have any problem with urological problems that requiring robotic surgery, perhaps can contact Dr. Warren from Glenn Eagles. And also I just would like to announce that HealthMetrics recently has been appointed as one of the panel hospital for Glenn Eagles has been appointed as one of the panel for HealthMetrics. So for inpatient and outpatient as well. So hopefully we can drive volume more to Glenn Eagles as well, and probably to your side as well.
Thank you.
Okay. So with that, I think if there's no more questions, so thank you very much. And Salam Ramadan and Selamat Berbuka for those Muslim out there. Thank you.